This bill would require that HHS provide weekly progress reports regarding the President's health care law, an attempt to ensure greater transparency from an administration that has done everything that it can so far to bury the facts when it comes to its signature health care law. Remember, this is the administration that knew millions of Americans would receive cancellation notices, but they only acted to allow people to keep their health care plans that they had and liked after we forced their hand back a few months ago. And perhaps by acting today, we can again force them to do the right thing and share basic information with policymakers and the public about how the law is working or not.
This should be easy, but what we're talking about here today is basic transparency, so we all have the data to assess what's working and what's not. This bill is a mechanism for accountability so we can get the answers that both Democrats and Republicans and state insurance commissioners and governors need to know in order to understand what's working and what's not.
None of the information being shared by the administration regarding enrollment means much of anything. We talk about people that enrolled, but we don't know how many people have paid and how many people have completed that process. What are the demographics of the individuals that are enrolling? All of this is information that the individual that is paying for this, the American taxpayer, deserves to know. Who has paid for this insurance?
Why would we not want to provide transparency? If the federal government is going to do a massive bureaucratic regime involving the American people, why should we not at least require them to be accountable for the success or failure of that regime? The Exchange Information Disclosure Act requires accountability and transparency, which has been, frankly, elusive from the administration on these issues.
The American people have a right to firm data and an accurate picture of the exchanges.